schools. So this is the measles rubella. Of course, we know measles is highly infectious disease, and it is one of the leading cause of death among young children. And we already know Sierra Leone, we have a very high infant mortality. That's why we have introduced the malaria vaccines, and we have been rolling out the measles. Initially it was measles, and then we changed to measles rubella. Of course, the measles causes 134,200 deaths globally, and most of these deaths do occur in the sub-Saharan Africa. That's where we are seeing a lot of death as a result of measles. Next slide. So of course, this is the cumulative measles cases. This was when we are actually writing the report in 2021-2022. We could see that there were outbreak of cases. In 2021, only 4 districts had reported outbreak of measles. And in 2022, we could see almost most of the districts had reported an outbreak of measles. And currently, there's an active outbreak of measles ongoing in Falaba and certain districts within Freetown. And of course, these are just in the measles cases. A lot of measles cases have been reported across the country. And in 2024, we could see that still in 2024, most of the districts, up to 12 of the districts have reported cases of measles, which calls for an action. So it's telling us from 2021, 2022, 2023, there have been cases of measles, and even up to 2024 now, as we are talking, most of the districts have reported cases of measles. And the numbers are just increasing because initially, after every 3 years, based on Gavi recommendations, we should do an intensified SIA, supplementary intensification activity should be done every 3 years. But I think the last one was done in 2019, and it was planned to be done in 2021 or early 2022. But because of the COVID-19, no intervention has been done. Last year, we've done a lot of PVs to actually reach more, but we are also using the routine vaccines that were meant for the routine cohort. And this also was leading to what? Shortage of vaccines, stock out of vaccines, because the vaccines we are using to respond to outbreaks and for the routine cohort. So with that, we are still not able to reach the target. But we believe with the measles campaign now, we'll have that possibility of reaching each and every child between 9 to 59 months. Yeah, next slide. So this is just saying, and the EPI, the weekly report, the weekly IDSR report that comes in, this is with the 2022-2023. There were cases of measles you could see from 2023. And actually in 2024, you could see high peaks of cases of measles across the country that have been reported through the IDSR. So saying that from 2022-2023, there have been reported cases of measles across the country. And it requires the attention of each and everyone present here. 23 Sierra Leone. Carine have reported the highest number of cases in the first 23 weeks of 2024. So Carine alone has reported 143 cases, and cumulatively 302 cases have been reported in week 1 to week 23 of 2024. So a lot of cases have been reported. And these are the cases that the surveillance team, the district team have been able to identify. There are communities very close to the border where healthcare workers are not reaching as usual, and some of those cases are difficult to identify. And as such, we need to protect our children and ensure the vaccine reaches each and every one. Next slide. So these are, of course, the objective of the campaign, to vaccinate at least 95% of children aged 9 to 59 months. So we want to ensure, in order to create that herd immunity, we want to ensure we vaccinate at least 95% of the target age group. To break the chain of measles transmission, to strengthen routine immunization, because during campaigns, we also strengthen routine immunization, we also strengthen nutrition and intervention, the albendazole, the vitamin A. We also want to strengthen, and of course, in this particular campaign, we also want to see how we deliver more malaria vaccines, because malaria vaccines are being given to children 6 months and 6 to 11 the first dose. And since the MR campaign also will be targeting 9 to 59 months, we think during the campaign, as we go out, we also make use of the opportunity to also target other children with the malaria vaccines, and also the penta and other antigens also will be delivered. And also we are in discussions with nutrition to also add the vitamin A and albendazole to the campaign. And of course, to improve malaria vaccine coverage by 25%, that's just for within the campaign, to increase the population immunity against measles. So we also want to build the herd immunity and have a better immunity profile at the end of the campaign. So of course, this is the vaccine. Effectiveness depends on age. Of course, we are using the Measles Rubella vaccine. We have moved away from the single measles vaccines, and now we are giving the MR, the Measles Rubella. And of course, at 12 months, and at 6 months is 50%. At 9 months, the effectiveness is 85%, 90 to 95%. But we know normally for children below 9 months, the risk of actually measles is very low, especially with the maternal antibodies. But once we have the 9 to 59 months well covered, it's possible that those will be protected against the vaccine. And of course, when we give the second dose increases the effectiveness to approximately 99%. So during the campaign, whether a child has taken the MR1 before or MR2 before, during the campaign we give them all the vaccine because we want to build an immunity profile. So during the campaign also we reduce the number of zero-dose children. We also target those children that have never taken any vaccine so that they could be reached. And we also do defaulter tracing and tracking during the campaign. Next slide. Of course, the campaign strategies. The campaign will last for 7 days. So the campaign will start from the 28th, which is Friday, and it will run up to the 4th across the country. It's going to be a nationwide. All communities must be covered within the 7 days. So micro-planning has been done. We have identified communities, and we have identified zero-dose communities. The health facilities have developed their movement plans. If you go to health facilities, they have developed their daily movement plans. We have sent supervisors, 48, to the district to support the training. As we are talking now, the district training is ongoing today, Monday, for 2 days, and then the chiefdom training will also go on for Tuesday. Our partners are also on the field supporting the training at the district level. The campaign will involve multiple strategies. It will be static fixed in health facilities, and there will be temporary fixed outreach because we want the facilities to still be providing services. And then because it's injectable, it's not like polio, when we do house-to-house campaign. So the facilities will move to one particular community. They will be static in that community. The social mobilization team of CHWs will actually go to the community, mobilize and caregivers, and then they will come to that particular point to receive their vaccines. And during the campaign also, we'll be making use of the independent monitors because we want the independent monitors to actually look at the campaign and look at the quality of the campaign. So they will also, as we are talking, the training of independent monitors is ongoing, and this one is being led by WHO at the Freetown City Council. So the independent monitors will also be deployed to the district, and they will actually check to ensure that all chiefdom or all villages are being covered. And at the end of the campaign also, we'll make use of, we'll be doing a post-coverage survey, and within 1 to 3 months. So the post-coverage survey will also be done to actually determine the quality of the campaign. So the independent monitoring will happen, and on the second day, we start on the second day of the campaign, and then we'll do so. That's why we'll also be doing finger marking for the independent monitors, and we'll also be giving vaccination card, because when the PCCS will be done, the coverage survey will be done, a month to 3 months, the finger marking will no longer be there, but the vaccination cards will also serve as a proof that the children were vaccinated. And of course, campaign will target, of course, one aspect also we have looked at critically is the adverse event immunization. So we have the adverse event following immunization committees formed at the district level. They are there in all the districts, and also through the National Medical Supply, it actually support the AAFI because it's an injectable. It's possible that certain amount of children will present with some adverse event, and if they do so, we should have the drugs or the needed to provide them the necessary treatment. Next slide. So I think basically on the MR campaign, this is what we want to pass to colleagues here, because at the end of the day, we need the support from each and everyone. We need colleagues in the hospitals to sensitize our other healthcare workers on the campaign, that even in the hospitals, we'll be sending teams to come to the hospitals to give vaccines. And also, and our civil societies here, we want them to promote vaccination, because questions will be asked. They are more close to the communities. We want them to educate the communities. If there are challenges in the communities, in terms of refusers, we'll be calling on the civil societies, we'll be calling on stakeholders. That's why tomorrow we'll also be engaging some certain levels of paramount chiefs and members of parliament so that they will all join us on the field, sensitize their communities, take ownership so that we can break the chain of transmission with regards to measles. This is not the first time Sierra Leone has been conducting a measles campaign. We have been doing measles campaign for a certain time, but we always want to intensify. And this serves us because now our strategy is after this MR campaign, we actually want to move away from campaign by strengthening our routine immunization system and through our periodic intensification of routine immunization. If we are doing if we strengthen our routine immunization and we do conduct quarterly periodic intensification of routine immunization, there will be no need for campaign because the purpose is for the periods is to actually reach where the healthcare workers could not reach. So on that note, we are here to engage you on this and see how you could support the EPI, the Ministry of Health, to actually cascade this further to our communities, to different places, and to people at different places of work. So on that note, thank you so much, and over to you, Mikey.
We can do better than that. Thank you, Dr. Kambai, for that explicit and precise dissertation. So now we go to Q&A, question and answer session. Is there any clarification? Is there anything that you think you want to know, or you have something to contribute to what has been said by Dr. Kambai? Any clarification? Any question? The microphone is here, so feel free to ask your question.
Thank you very much, Doctor, for your presentation. During your presentation, I don't know whether I heard you correctly. You talked about trainings being conducted in the district. And we are here engaging stakeholders. Shouldn't be the reverse, that is, the stakeholders should be engaged before trainings? Any doctor, if you have any suggestion now, will that be effective, or will that be communicated back to the district?
Thanks. Yes.
I'd like to thank Dr. for the presentation. From the pharmacy work, we are our main source for this particular campaign is documentation of AFI. I don't know what the structure is going to look like. Are we going to have active teams going around the teams that are doing the administering the vaccines, or is it going to be through the normal routine? Because from the literature, it has come out that when we have this campaign, this is where we have the highest number of reports coming into the center for processing to innovation. So we've had this discussion sometime ago that in future campaigns, we should have active teams moving alongside the teams that are doing the administering the vaccine so that they can document on site, so that we can increase on the number of reports we can get so that we can process innovation. Thank you very much.
All right, thanks so much. Any additional question?
Yeah. Thank you so much for that wonderful presentation. When you were giving your presentation, you mentioned that carrying was the highest. So I become concerned. Therefore, I want to know why carrying the highest.
All right, I think we can take this first round of questions, and of course, then we can just have the last. So let's hear from Dr. Kambai on the 3 questions.
Yes, thank you so much, Michael John, and thanks for our sisters and for this question. So, and I agree with you. You see, the training and the stakeholders engagement. These are things that could go on simultaneously, because the training is focused on the content, on how the which should the vaccine to be utilized, and actually explaining around the strategies or the micro planning, or in terms of movement of teams, the number of teams allocated to district, and how those districts will actually, each team, we have 3-team composition. We have a vaccinator, we have a recorder, and then we have the social mobilization. So the recorders, for example, will be trained on the reporting tools. How are they reporting the children vaccinated? And this, we have developed a Google tool that they have to be trained on, and the data will have to come in daily, because also our colleagues or partners from Gavi will be looking at that dashboard to see the number of children, for example, vaccinated on the first day from Thailand, or second day of our PHU. So they will be trained on that. The vaccinators also will be trained on how to go about the vaccination in terms of recording, in terms of and keeping the vaccine safe in their movement. And of course, the social mobilization officers will also be educated on key messages and how they could or would mobilize the community stakeholders. So I think it's really important for the training, because the training is focusing more on the technical aspect, where we are also, even though we have done a lot of stakeholders engagement, but it's good to keep engaging stakeholders, because you may be in the hospital and the team or a cross-section of vaccinators are there to give vaccines, and maybe someone that is not aware may say, no, they are not allowed to come to this center to vaccinate, or in schools, no. So that's why we are all doing this engagement, so that we are all on the same page. So wherever they reach, someone will be aware that yes, there's really a nationwide Measles Rubella campaign ongoing from the 28th to the 4th of the 8th of this month to the 4th of July. And also, you also here to serve as ambassadors to actually sensitize and engage more people on the Measles Rubella campaign. Documentation of the AFIs, of course, we are working with this with the Pharmacy Board of Sierra Leone and of course the WHO. So we'll also be doing active research on the routine. So that's why one of the things we did was to actually engage the district, and as part of the national supervisors, the Pharmacy Board will be included, so that you will also join us on the field. Whilst we'll be focusing on the AFI component, we can also focus on different other aspects. Of course, Carine being the highest case. You know, Carine, Falaba, these are also 2 new districts. There are 2 new districts. There are districts that are really far apart, and also these are border districts, very close to Guinea, where the movement of people from both borders, people are moving in and out. And of course, it's been also a new district. These are districts where also over the years we have experienced or observed low vaccination rates. You know, also they have a lot of how do I call them, nomadics, where people are moving from one community to another with animals, and most of the time even vaccinating them becomes an issue, because it's difficult to capture them at a particular point. And so because of some of the low vaccination, the movement of people, I think those are some of the issues related to the outbreak. And in our surveillance report, most of these cases that have been reported from Caribbean, there is no proof of vaccination. Because sometimes the way of proving whether they have been vaccinated is actually looking at their under 5 cards or any register they have for booklet to see whether they have actually been vaccinated. So sometimes we do not really confirm whether they have been vaccinated or not, and these are new issues. So that's why we are even expanding on immunization services in those areas. We are currently constructing district stores in those areas so that we can have vaccines enough in the district, and those vaccines to actually reach those eligible for the vaccination. So the stakeholders engagement is really important, because we want each and everyone to be at the same level in terms of information, and also we will also serve as ambassadors right out there to actually sensitize and educate other colleagues on the importance of vaccination. You may be in a particular point at some given time where a caregiver may refuse vaccination, but with your intervention of all of us here, it will be easy to convince them that yes, this vaccine is for you, and this vaccine will protect your child from measles, and we encourage them to take all right. So even when we do campaigns, it's not just to give the measles campaign, but we use campaigns to strengthen the routine immunization. We use campaigns to reach more, because doing campaigns we reach more. And when we reach more, we sensitize them. That will prompt them to link up to the health facilities for other vaccines. So I think those are some of the few I could say to the questions asked. So we are still here and we are open. We want colleagues to really ask more questions before we clarify and some of the concerns or doubts you have. I think it will help us better and also convey the message on behalf of the Ministry of Health. Thank you and over to you.
Thank you, Dr. Kumbai. All right, so on that note, I also want to use this opportunity to recognize our Director of the Directorate of Planning, Policy and Information, Dr. Smart. Dr. Smart is here with us. Dr. Smart, can our participants see you?
I'm at the back.
Dr. Smart will come in front. At least let's recognize his presence. We also have Dr. Smart, you are highly welcome. You can have this one thing. We also have in our midst also the Deputy Chairman of the NITAC, and then the President, Mr. Arena, and the Arena. Mr. Arena, can they see you that you're here? All right, Mr. Arena is here also. These are critical people in our midst, and then we cannot go without recognizing them. Okay. And then among our civil society, one of the core civil society who has been supporting also what we are doing is and then the director and the executive and then officer and senior commissioner and then Chance Mabu. So Chance Mabu, can they see you? All right, so we have and then civil society who has executive. And lastly, also we do also have and then the assurance people. GT Global, they are also here. We have Mabu and Alvin. Mabu and Alvin, can people see that these are assurance people? They are there to put the dots across the T's in all what we are doing. So we want to say thanks to all of the critical people who are here. And then we just maybe take two and then one set of questions and answers. Then we then move on into statements. Where we also have the various people also to also give their statements on this, then we'll move on to the panel discussion. So we have a question here, and of course, if people are here also experts, subject experts, people are here also to provide answers to some of the questions. Over to you, sir.
Thank you very much. I am fully grateful here from Graduate Teacher Senior. We are pleased to be here and in this stakeholders meeting. The campaign targets people 0 to 59 months. For most Sierra Leoneans, we are not so conversant with months. We are conversant with years. When you say 59 months, people will find it very, very difficult to know the age bracket. We prefer you use the years. Let's calculate 59 months and then tell how many years, 0 to how many years, for easy understanding of our people. That is point number one, so that the message will go stronger and stronger. Number two is the sensitization period. I want to believe the campaign will start on the 25th, am I correct? So it's up the 28th, few days from now. How many of Sierra Leoneans know about it? The time frame is very, very short. So we have to use robust sensitization so that we'll capture more people based on the time left. And for us at the SLTU, we have 100 branches right across the country. I think one way we will have to assist is we have WhatsApp groups in all these 100 branches, and if we can have campaign messages, we can send to these of our members right across the country, 100 branches. It will help us. So you have to assist us with that, the campaign messages, so that we'll act promptly to make sure that teachers, schools all over the country know about it. That is one way. And we have our nursery school association, where most of the targeted people or the children are targeted in these nursery schools because they are within that age range, 0 to 5 years as the case may be. And we also have to communicate with the nursery school association so that we make them know about it. The other question, have you done a survey about how many of these children get nationwide? The reason why I'm asking is for us, if there are enough vaccine to target these children right across the country within the age bracket. And we also have to address the issue of meat. Forget our parents, the parents of these children, to get them have the sensitization, to have the education, to see the importance and the danger of this measles. Because they have meat, they are thinking about vaccine. When you vaccine children, they have a lot of stories behind it. We have to make sure that the meat behind this vaccine, not only for measles, but other vaccines, we have been having this meat, and parents will refuse to have their children being vaccinated against this dangerous disease. So on that note, we are happy to be here and want to work with you strongly within this very short time so that the message will go far and wide through using our structures right across the country. I want to thank you for your attention.
Well, we already started the second segment. Any further questions? That's from SLT. Yes. Any question? Any clarification?
Yes, I am Megatin from World Vision International Sierra Leone. As an organization, we are happy to be here, and then we are always in the need in order to support the efforts of the government and the ministries. So I have a few concerns which I want to just highlight. First, I may want to know if there are any other resources that may be needed in order to strengthen vaccination coverage so that people can have access across the different regions. And then, since you mentioned that Karine is having the highest burden, I want to know if there is any other strategies which you've put in place in order to actually go their foot force and see how we can curtail the number in which they have. And then, as an organization, we may also want to know if, or maybe ensure if there is any sustainability, long-term and effectiveness of Measles Rubella, and then also the vaccination campaign. Thank you very much.
Okay, I think that's it. We take last. Okay, from that side. Okay, I think we are fine. Also, but we asked us to provide a response and then to the question.
Amanda, do you want to respond to the health education? Stand on. You want to respond to some? Or let me go. Thank you so much, sir. And we really do appreciate the effort of the Sierra Leone Teachers Union. And we are really happy, and myself, I feel really good to see you around. Because when we talk about vaccination, we work strongly with the Ministry of Education. And what we have done is, and through the Permanent Secretary of the Ministry of Health, an official letter was written by the Permanent Secretary to the PS of Ministry of Education, and we are informed also that they have sent out letters to the schools so that and our teams could actually go to the schools and give vaccines, and we kindly request your support, sir, yes, sir, so that this trip round won't have issues in schools. Thank you so much, and I'm going to keep your contact so that we'll keep in touch, because all our vaccines are being delivered in schools, and we really want to improve on outreach to schools. Thank you so much, sir. So the age, I agree with you. It's just that sometimes when we are doing vaccination campaigns, we measure in months, because like when we say 59 months, you know, it's under 5s, not so. Yeah. But your point is clearly noted, and that's why at the community level, the strategy we are using here to pass to communicate with you here at the national level, it will be different on what will be used in carrying. So that's why we even employ colleagues that will be speaking the local languages, so that they will actually communicate in Mende, Timini, Fula, Kramko, and the rest to our people, so that they understand better. In terms of vaccines, we have enough vaccines to vaccinate all children 9 to 59 months. Or say 9 months to under 5s, not so, for all under 5. So we have enough vaccines to vaccinate all of them within 7 days. And of course, sensitization is very key, and we count on each and every one present here. And we are also using the CHWs. We know here in Sierra Leone, in all communities, we have CHWs and yes, supervisors. So we are also using the CHWs attached to communities or in communities to actually support the sensitization. We are doing radio programs, we are playing jingles across the country. I think we did jingles in 11 languages so that they are being played across the country to actually sensitize people. And of course, we are using civil societies, fireman chief, and stakeholders across to actually support. So in terms of parent being sensitized, that one is ongoing. But sensitization is an ongoing process. It does not stop. Even after this ML campaign, we still have to be sensitizing people on vaccine and the safety. But one thing we always want to assure it's Ministry of Health, we are always using vaccines that are being pre-qualified by WHO, and we are ensuring we keep the vaccines properly at the adequate temperature. And even during vaccination, you see our staff with those vaccine carriers also just to keep the vaccines very safe. In terms of needed resources, of course, resources are always needed, and especially for this campaign, and the area we have that is we will not provide vehicles to our staff to move, because we have seen when we hire vehicles, we give to supervisors, moving from one community to communities, they follow up on vaccinations, or sometimes we provide them the needed resource to some, even though it has its own disadvantages, but they take motorbikes, they go to those communities. I think it has been providing better results because they also support the district in terms of distribution of vaccines, reposition of vaccines. Those areas are also. Of course, sustainability. We are giving the Measles Rubella vaccine. It's part of our routine immunization, and it's already in our routine calendar. So I think it's already there. We are giving the vaccines. We just have to keep improving and making it better. And the government of Sierra Leone has been very dedicated in paying vaccine co-financing, and we will ensure they will pay the vaccine co-financing so that it becomes very sustainable. Sister Nune, I think you want to say something. Over to you.
Thank you very much, sir. Thank you. I just want to maybe add something very small. Say, our brother that is concerned about the 59 months, maybe like manager has said, it is because we are here at this level, and also when we are talking to technical people. But even the jingles, when the jingles were being finalized, we had a lot of discussions around that, so that we really put it in a way that people can understand. Yes, even. And then also the concerns about the time being very short. Yes, we agree, but like manager said, some activities around this have been going on, and that is why almost everybody here, we are systematically selected. These are people that will say they have very large constituencies. We have professional bodies represented here. They are representatives, Sierra Leone Midwives Association, Sierra Leone Nurses Association, they are being represented here, Teachers Union. So, and we have networks. Okay. So we can use those platforms to really see how we can support the process by sending out messages so that they understand, and then at their own level they can also continue. And also in the area of support manager, I also want to add something that, like when we had the other campaign for the Western area districts, the number of supervisors that we have, they are very small for Western area. We have 3 national supervisors across all districts, but for the Western area districts, it's very difficult for 3 supervisors, but due to budget limitations like a manager mentioned. So if anybody can support with additional supervisors for the Western area districts, these are very difficult places to work, both the urban and the rural districts. So that's just what I wanted to add on. Thank you.
Yes, thank you so much, Sister Lulu. I think our brother from World Vision, in our last NOPV campaign, when we did the first round of the NOPV campaign, we identified the challenges, especially in Western area, urban. So we asked Child for support. They supported us with more and supervisors, and also we reached out to the FETB program, the US CDC. They also supported with more supervisors. So even Western area urban that will not pass the NQAS in the first round, in the second round, because of the supervisors, everyone was on the field going up and down, supporting with the distribution of vaccines. And even the supervisors, we are working with the teams. We saw at the end of the day, Western area Urban did extremely well, and they also passed the NQS. But sometimes, Gavi is providing a holistic support for the MR campaign, but also there are some gaps that we have been trying to mobilize more resources. Recently, also we got some support from UNICEF to actually support the deployment of MOHS top managers, staff on the field, so that they could actually supervise the campaign. And also we got support from UNICEF for also additional teams to be allocated to places like Carine and Calabar. So those are areas now we need support, assistance, getting more supervisors here at the national level, and of course support those areas with mobility. So on that note, thank you so much, and also we would like to recognize the presence of our honorable member of parliament, the chairlady of the health committee. She's always with us at the EPI, and they are actually supporting our intervention. I remember in our last NOPV campaign, just to get high coverages and get people to really take the vaccines, we had to call on the member of parliament to help us with members from the team, parliamentarians to be deployed on the field, and they were in most of those hard to reach areas so that they could actually talk to their people to actually go out and get the vaccine. So thank you so much. Thank you. Honorable member of parliament, welcome, and it's a pleasure to have you here. Thank you so much, and over to you, Mike.
Thank you, Dr. Kambai, for that clarification. So I think that's answer to all of the questions, and then we'll definitely want to move to the next segment of this session, and then where you want to take and critical statements, and then from our stakeholders present there. So on that note, I would like to invite on that note, I would like to invite the following people to kindly occupy the high table. And then we already have Honorable sitting down on that nice high table. Honorable, just remain seated. That's your position. All right. So we want to invite Mr. Charles Mabu to join. And then Honorable on the high table, Mr. Charles Mabu. Let's put hands together for Mr. Charles Mabu. It's going to represent the civil society. We'll also invite the representative from African CDC, the Clements, will also join. Mr. Clements. And then next to Mr. Clements, we want to invite our Deputy Chair of NITAN, Mr. Adigena. And we'll turn together for Mr. Arena. And lastly, and then we will not do this session without having a voice of the meeting. And then on that note, I will want to invite our director, I also invite our director. Director, you are invited. There is no person of higher authority to talk about the things in this room. But you, let's put our hands together for our Director of Policy, Planning and Information, Dr. Francis. First, taking the statements, and then of course, Dr. Kambai will just be a clear overview in the 2 minutes, then we move on. Over to you.
Good afternoon again. I think it's afternoon, not so. Yes. Good afternoon. This is just a quick overview. I have already done given a background of this meeting and this stakeholders consultative meeting. So we are starting the Measles Rubella campaign and from the 28th of June to the 4th of July. It's going to be a nationwide campaign, vaccination campaign, where we will be targeting children 9 months to below 5 to 59 months. And we want to reach each and every child in Sierra Leone with the Measles Rubella vaccines. So as part of our ongoing engagement and sensitization, we have all stakeholders here today to update them on our strategies and what we expect from them, for them to support the process and also to pass on the information to their different communities or institutions so that people could be well informed on the campaign. Here we have different stakeholders from the Ministry of Education, the local government, the local government, the Ministry of Education, civil societies, our media. They are all here so that they could support us in passing this message to the entire population. Thank you so much, and we are happy that you have made it possible to be here with us. Thank you, and over.
All right, thanks. Thanks to Dr. Kambai. So, first, on these statements, we'll then ask our partners. African CDC is here. We want to ask Mr. Clemens, representing the African CDC, to make this.
Okay. Okay, so good afternoon, everyone, and thank you so much, the Minister of Health's PI leadership, for organizing this and also inviting Africa CDC to be part of this very, very important engagement. The message about measles, the burden in Sierra Leone, why the campaign is coming up, is well captured in the presentation made by the program manager. Also, the dates clearly communicated. All the questions, I think they were also well addressed. And of course, looking at measles, bringing stakeholders together is always very, very important in every public health intervention that needs to be implemented. And so it's a very good step in the right direction, and we all will agree that we cannot underestimate the power of collaboration. We all need the key stakeholders here and beyond in implementing this campaign. We know it that measles as a disease, yes, causes not just the illness immediately, but also have lots of complications if not properly treated. And therefore, vaccine has been one of the most important public health interventions against this disease. And so we need the support of all the stakeholders so we can be able to reduce the disease burden and also stem the transmission of the ongoing outbreaks as presented at the district and in our communities. By this, we'll be able to not just save the lives of our children, but also economically save the pockets of our parents, and also allow the parents time to concentrate on their businesses rather than taking care of these children in the hospital. And therefore, I urge us all, in the interest of our children, the children of Africa, which is what Africa CDC is looking at, not just for our children in Africa, but also as we save these children, we safeguard our health security, not just for Africa, but for the world at large. I again thank you all and hope that these messages we use our network, reach out far and wide, also help the teams on the ground, so we can resolve if we have people that don't understand what we are doing, we can be able to educate them appropriately, have all our children vaccinated, so that we have a safe Sierra Leone and a safe environment for us to all work. I thank you so much and appreciate being here. Thank you.
All right, thanks. And then Mr. Clement of the African CDC. And then it's good that you also tell us all the partner support towards this. So we want to ask for the Deputy Chairman for NITAG, and then Mr. Adeyena. And then NITAG is much more responsible in terms of recommending to the country on the vaccine which should be used. So we want to ask Mr. Adeyena to kindly give his own statement. Thanks.
Thank you very much. Thank you very much, Mr. Jones. On behalf of my chairman of NITAG and the membership, I want first of all to register our very profound gratitude for inviting NITAG to this stakeholders meeting. Now, some of you might not know what NITAG means. NITAG, N-I-T-A-G, as the acronym means, National Immunization Technical Advisory Group for Sierra Leone. It is comprised of health experts, very experienced ones. Majority have been chief medical officers, and we also have representatives from the Sierra Leone police. You might wonder why we have a policeman there, but the police have got a hospital headed by a director. So the director is actually representing the Sierra Leone police force in the NITAG. We also have a health economist to look at the health component of vaccines that are to be introduced in our country. Now, we work very closely with EPI, and I must say, since the inauguration or the establishment of NITAG, we have, through the support of the EPI program, able to make necessary recommendations for vaccines that are safe and of high quality to be introduced into this country for the safe growth of our children. Not all vaccines are vaccines, and I wouldn't like to waste your time on that, okay? But we are doing our level best. So with this new MR campaign, I want to implore all of us to get our hands on deck. This is for our children in this country. Let us make sure that we have very safe children in this country. They are future leaders. We need to do the best for them. So please, don't stay behind. Make sure you are part of the wagon. So with that, I want to thank you, Mr. Dr. Konbai, for inviting us to this meeting. And we will continue to support you and your team as and when necessary. Thank you very much.
Thank you very much, Chairman, Deputy Chairman of NITAG, for that statement. And then you already have given us a background of what NITAG is about and what they're doing. And then, of course, the vaccine we are introducing was recommended by NITAG. So that we will say thanks to Mr. Adegena. And then we cannot do anything without our civil society. They are very important and they have a major role to play in terms of reaching out to communities, reaching out to caregivers. So on that note, I want to ask the civil society representative, Mr. Charles Mambu, and then to make a statement on behalf of civil society.
Yeah, thank you very much, Mr. Moderator. Let me join the previous speakers to commend EPI and the Ministry of Health and Sanitation for yet another rounds of immunization to combat some of our killer diseases among our children in Sierra Leone. As they say normally goes, among the 5 factors of production, the entrepreneur is rather very important, and this is actually what we are saying in the Ministry of Health and Sanitation. With a focused leadership coupled with supporters as directors and program manager, in this case Dr. Kambai for EPI, I think we have seen a total recognition of the efforts of the government of Sierra Leone by our development partners in terms of scaling up immunizations among our children under 5 as well as our women and those who actually needed it. Just a few days ago, we witnessed at the Ministry of Health Conference Hall a recognition letter that was presented to the Honorable Minister. These are pathway. For us working on this sector, we have recognized vaccination as one of the most economical way of preventing diseases among our children. It's very effective, efficient, widespread. And I want to again, as usual, assure you, the leadership of PPI and the Ministry of Health, that the civil under the leadership of Health for All Coalition, we continue to spread out the information to our communities across the country to ensure that those who are eligible to be vaccinated are actually presented for vaccination at those areas. In the presentation of Dr. Kambai, somebody raised an issue of Caribbean and Faraba. I have also made this presentation many times to our partners that Caribbean and Faraba are 2 new districts created to ensure that they have access to health and economic services. However, the dream of those who created those districts have not come to pass. As we see it, Caribbean, for instance, Mongo, it takes you nearly 8 hours to drive a 4-wheel vehicle from Kabbalah town to Mongo, which is a district headquarters town. You have similar problem also to Caribbean to move around. So we are seeing the results that are being shown in terms of access to immunization facility by our people over there. So I applaud Dr. Kambai and his team, and I want to thank him for the special focus that will actually be made to those districts. I really want to state that, and we want to make sure that this time around we have large number of people in Caribbean and Faraba that are actually vaccinated, because their situation is very peculiar. We need and they need special attention because they are part of us. Why is this necessary? When an outbreak occurs in one district in any environment, it spread out very easily. We are attacked by Ebola that started in Guinea and it spread in West Africa. COVID started in China and it spread around the whole world. So what happens to your neighbor, to your family, no matter how far they are, it must be a concern to you. Make sure you always become your neighbor's keeper. thank you again, and I want to thank our chair for the health committee. She is always available for health intervention. Always, always. Madam, I want to thank you very much. Thank you.
Thank you, Mr. Chancellor, our senior commission. And then it's also important that you mention how critical civil society is in getting this message, and also recognizing that yes, the Ministry of Health strives towards and then improving on immunization and immunization coverage. Thank you so much for the support, and thanks to all citizens for the support. So on that note, colleagues, there is no way you can succeed without not having the legislative arm of government involved in this whole process. And then members of parliament is the people, they are elected by the people, and they are representing us at the parliament to make laws, and then which govern a lot of activities and a lot of pressure. So on that note, we are grateful, and then we are delighted to have with us the chairman for the health committee chair, and then Honorable Solga, to give us a statement on behalf of the health committee chair. Let's put that together for Honorable.
Thank you, Michael. Apologies for being late. We have various engagements today. There is another engagement on HIV/AIDS that I had to be there as well in the City Council Hall. And there's another engagement on the CSOs from the Female Caucus of Parliament, which I happen to be the president as well in Parliament. So I've been divided all over the country today. I'm running around from here to there. But I'm here now, and I'm glad to be a part of this engagement. I always say in my statements that a few years ago, it was difficult for you to be hearing about vaccinations in this country. It was happening, but it was not being spoken about widely and broadly as it is right now. That tells us that something is happening good. The message is now being spread. There have been a deliberate effort by the leadership of EPI to have a collaborative engagement and inclusiveness of stakeholders all around the country, and that has actually helped. Because recognizing the stakeholders and recognizing the efforts of everybody involved just means it makes your job easy. This is what the leadership of EPI have done. Back in our constituencies, in our districts, in our villages, there are key stakeholders that make things happen. And bringing them on board means you don't have to go down those constituencies. They can do the work for you. And it has been very deliberate as well by having members of parliament included in every activities of the EPI. The last exercise that was done, as Dr. Kambai said, we had members of parliament going down to their constituencies and even districts that they don't belong to monitor and supervise, which is part of our role to do oversight visits. They went on oversight to monitor how these activities were being carried out, whether it was being done well, what their concerns were, what the constraints were. And I must assure you, Dr. Kambai, that I came back yesterday from my travels and I met a comprehensive report from the members of parliament as per their observations, which I've asked the clerk to share with you, as they did recommendations and things that they saw was going on very well. These are the kind of things that we need, because as part of our role as well as legislators, we don't just sit in parliament. We want to be able to know that the laws that we are making are being implemented well. They are fit for purpose. The budgets that we approve, the agreements that we sign, everything that is being done in the parliament has to go in line with what is needed by the people. And so it's only through the recommendations and the reports that we get that can make us better legislators. So I'm glad to be here, and we have been working very closely with the ministry, EPI in particular as well, along with different other departments in the ministry to ensure that there is that relationship with Parliament and the ministry, and to ensure that the people see that collaborative effort, that we are speaking with one voice. It is better to catch them young, because speaking of next generation, you cannot have a next generation if they are not healthier. So this is the right direction to go, and be rest assured that Parliament will be there every step along the way to support you to ensure that we succeed. I thank you.
Thank you, our honorable chair for Health Committee Chair for Parliament, and we are happy and delighted to give us that assurance that Parliament is always available to support us. And thanks also to colleagues who participated in the NOPD supervision. We are grateful, and we are looking forward to see more of your visibility of members of Parliament in EPI activities and Ministry of Health activities. And then to close the statement, and then definitely you will definitely have to hear from the Ministry of Health from the leadership point of view about the whole exercise. And then today we are grateful to have, and because the person who is in charge of planning, the person who is in charge of policy, and the person who is in charge of information. And then when you see this person, you know it carries a lot of work at the Ministry of Health. We are grateful to have Dr. Francis Smart, and then to give us a statement on behalf of the Ministry. Can we put our hands together for Dr. Francis?
Thank you very much. Good afternoon, ladies and gentlemen. Good afternoon.
Yes, good afternoon.
Good afternoon. Let me stand on existing protocols, but with special thanks to the Honourable Member of Parliament who will crisscross as we move along with health interventions. I have the privilege to close this event, and it's a very important event to the Ministry of Health and Sanitation. Firstly, we all should know and remember that immunization is the bedrock. It's one of the 8 fundamentals of public health. And so during the AMA Declaration, 1978, this has always been a pivotal part of public health. Importantly for Sierra Leone, we have reduced maternal mortality significantly, even when the figures we still are associated with are not acceptable. But it's important to make the point that child mortality is very high, unacceptably high. And therefore, immunization is one of the activities, primary activities, like we will say, prevention is better than cure, that will help reduce maternal mortality, infant mortality. And so, immunization is a fundamental strategy we use for measles in particular to reduce infant and child mortality. And therefore, the complexity of the interventions, as you can see here, the stakeholders meeting, the inclusion of civil society, parliamentarians, and all and sundry, I will want to emphasize, is critical. For some of us who have worked at district level, you will see that when immunization is going on in the community, you need all these stakeholders to be on board. For measles in particular, let me come to the technical elements. To the technical elements of immunization. We know what we refer to as herd immunity. So communities have to be covered enough to attain herd immunity. So herd immunity, put simple, is many people have to be protected to get the larger population protected. So it means if you look at Gales and Lucas, they will quote around 84%. For a population to be protected, those who are at risk, at least 84% will have to be vaccinated. So when I talk about the stakeholder scope, it means for you to get those kind of high coverage, you need to have everybody on board. You will also recall, I think it was during COVID, we have a series of outbreaks. And this is exactly because of the concept of herd immunity. Because during COVID, we missed some of the vaccinations we were supposed to have. I know from the data also. Let's put that phone off. That's the best. So as a result, we have these sporadic outbreaks. And therefore, it is important always to have everybody on board so that you optimize the coverage. Like the manager said, I know I missed some of the presentations he made, but you have to make sure the coverage is high enough. You take everybody on board in order to meet this coverage. There have been outbreaks in the past, and we need to nip those outbreaks by using SIAs. And so SIAs, like he said, are interventions where you increase the coverage. You have high coverage compared to routine immunization. So the SIAs for measles is coming back soon, and therefore we implore everybody, just like in the big team, but also in our communities, to have hands on deck and make sure the coverage is exceptionally high. Last but not the least, from my experience in Bond as JMO, you know, Bond Island, we have corners in those water and riverine areas. They are always difficult to cover. And so most of the times, the data will show you that it is in those hard to reach areas that we have to focus on in order to really make sure we minimize outbreaks for measles. On that note, let me congratulate the program and the leadership there, because we really know, like Mr. Chasmambu said before, and I think Minister will echo that in one of our meetings, we are doing so much well as a country on immunization. And efforts, results are actually achieved out of good leadership. On that note, on behalf of the ministry, CMO who is not here, I want to say thank you, and thank you to all of our stakeholders, because success is not done by one person. You know, say one finger no go pick stone. So when you want to get things done, you need everybody on deck, and I look forward to that. We'll make sure people are able to supervise and monitor the process so that we can get the usual high coverage. Thank you, God bless.
Thank you so much. Let's put our together. Smart. Said a lot about the ministry support and how this is important to the ministry, and also recognize the efforts of the honorable minister in pushing this forward. And we also want to use this opportunity to recognize that also in our midst we have our honorable Member of Parliament from Kenema, and then so we have Honorable Mariama Ella Gopa. Not so, I'm right. Madam Gopa, can they see your hand, please? She's the Honorable Member of Parliament from Kenema District, and then women are taking over this Parliament. Yes, we are happy that we are seeing women. So on that note, I want to say thanks to all of our key stakeholders who have given their statements, and then we want to say thanks to all of you for giving the statements. Some we even asked them in short notice to come and give us the statements, and we are glad that they are here. We want to say thanks to civil society partners and Dr. Smart for joining us. So on that note, we want to ask our high table to kindly take their various respective positions, and then lunch is ready. We'll then move on to lunch, and then of course come in with a panel discussion. Amanda, is Amanda around? Yes. So lunch is ready at the main hall. We can go there. It's for 30 minutes, and then we can have lunch and come and then have the panel discussion. Thanks to all of you.